A 28-year-old Asian man with hyperthyroidism had been well for months until, after an intense workout and high-carb meal, he suddenly felt his legs becoming unusually heavy and couldn't stand. Within minutes, weakness spread to his arms. In the emergency room, his potassium level was just 2 milliequivalents per liter, dangerously low. What happened? And why did the weakness spread so fast? Let's explore the pathophysiology behind this episode. In some patients, especially in Asian, a rare complication of hyperthyroidism can occur called hypokalemic periodic paralysis, which is also known as thyrotoxic periodic paralysis. Because of overactive thyroid gland, the thyroid hormone upregulate and stimulate the sodium-potassium ATPase pumps in the cell membrane, particularly in muscle cells. These overactive pumps aggressively push potassium from bloodstream into the intracellular space. Result in sharp drop in serum potassium, that is hypokalemia. And even though the total amount of potassium in the blood is normal, this low potassium interfere with muscle function. Normally, the sodium-potassium ATPase pump push 3 sodium ions out of the cells and bring 2 potassium ions in, because more the positive charge leave than enter, and also because of negatively charged protein that remain trapped inside the cells, the inside of the cell become negatively charged compared to outside. This creates the resting membrane potential of about minus 90 millivolt across the muscle cell membrane. Now, in thyrotoxic periodic paralysis, the sodium-potassium ATPase pump aggressively push potassium inside the cell, leading to low potassium in the blood. This imbalance causes a net gain of positive charge inside the muscle cells, shifting its resting membrane potential from minus 90 millivolt to an abnormal, less negative value like minus 80 or minus 70 millivolt. This shift is called sustained depolarization. This might sound like the cell is more excited, but it has a devastating consequences. It tricks the cell sodium channel into thinking an action potential has just fired. So, this sustained depolarization inactivates the voltage sodium channels. Since these channels are stuck in off state, the muscle's fiber can no longer generate an action potential, leading to sudden and profound paralysis, despite brain send normal signal. These attacks often happen after eating a lot of carbs or after vigorous exercises. That's because both carbs and exercises make the hormone insulin goes up, which push even more potassium inside the cells, making the blood potassium level drops further. This weakness or paralysis can last from a few hours to as long as 2 to 3 days, and then gradually goes away as potassium level return to normal. It is much more common in men, about 30 times more than women. Along with potassium, there is also low phosphate in the blood,